in rural and remote areas usually have it tough when it comes to access to medical care. This as the country rollouts the second phase of the COVID-19 vaccine. The University of Fort Hare says that unique approaches and significantly increased efforts are required for the successful rollout of vaccines, particularly in rural and remote areas within the Eastern Cape province. Now, these include other provinces facing similar challenges. But Faculty of Health Science Dean, that's Professor Leon van Niekerk, joins me now to unpack what these recommendations are. Prof, good to have you, and a very warm good morning to you. I just want to start with perhaps some of the recommendations that you make. Perhaps even before I do that, you raise, some concerns in terms that there needs to be quite a unique approach here when dealing with remote and rural areas, particularly when you see in the Eastern Cape, Limpopo, Free State, those are quite rural areas. What do you think are those approaches that need to be considered?
Yes, thank you and good morning. And thanks for having me this morning. Some of those challenges, especially those for remote areas in our country, is very often accessibility to healthcare facilities. I think that is throughout the country one of the major issues that will challenge our departments of health to provide these services, especially the vaccination to our elderly people. Because you know that many of them have to travel quite significant distances, sometimes further than what the World Health Organization would deem as acceptable to walk to a healthcare facility. So the challenges for them to overcome, apart from the online approach that the departments have and not having access to connectivity, the traveling and the distance of traveling is one of the most important challenges to be overcome. The other is the perceptions that they might have. There are messages coming through that some of these vaccines are not very effective.
Right.
Some of them might have side effects. And because there's not always a good communication line between the departments and people in rural areas, they might come to a point where they think, should I go, should I not go, what will convince me, what will not convince me? And those perceptions needs to be addressed also as a way forward to assist our elderly to get this vaccine.
Well, Prof, if I may just jump in there.
Healthcare workers.
Yeah, if I may just jump in there, because it seems that among some of the challenges that you also address is the issue around the number of vaccination sites and the fact that, the communication ecosystem that is identified within the Eastern Cape province requires more of an in-person, conversation, door-to-door, as opposed to, hey, get your smartphone out and simply register online.
Yeah. The online approach is going to be a huge challenge, and face-to-face communication has always worked in the Eastern Cape, especially engaging some of our traditional leaders and imbizos and to get the message across, as well as church leaders, religious leaders, as well as, some of the local leaders in those areas, especially NGOs that are working in those environments consistently.
Right.
They have quite good access to people, and the message could be spread through them much more effectively than just an online approach.
Yeah.
So yes, that challenge is awaiting, and I don't know whether much of this information is getting to the deeper rural areas of our country. That is a huge challenge to be overcome.
All right. Well, Prof, we have to leave it there due to time, but thank you so much for your time. But also just highlighting how, a unique approach, I suppose, needs to be addressed here by government, because we can't use sort of a blanket approach when it comes to all provinces. There's some that do need special attention and would need a different strategy to address some of the issues pertaining to the vaccine rollout. That was, of course, Professor Leon van Niekerk from the University of Fort Hare.